as we speak about structural barrier accessing care among transgender. Speaking about structural barrier, you have a lot of examples. I will take some examples, but for care in general. Okay. You know? Okay. Where I come is not authorized to speak maybe about condom to secondary school. When you speak about HIV, you just keep all those aspects, but not speak about condom. The fact is that when those guys become positive, now you start to speak about condom. Or you know that condom is one of the elements to prevent HIV. Speaking about transgender, is a group of population who are difficult to reach, and through some example of activity we are made on the field, we are show how structural barrier influence those activities. Data are very few in our country. We have IBBS done in 2018, who give me some data, and we show that the prevalence was 27%. With activity on the field during the third quarter in the fiscal year 24, you have a yield of 50% only in one city. So it becomes difficult to us to work with challenge we have. Stigmatization is one of Okay, we are saying that stigmatization is of one element who impact our activity. We have stigmatization in the health facility where healthcare provider do not accept to give services to transgender. It's true that we have some who have confidence, who came and give the service, but it's difficult. Also, in the key population, stigmatization are also, transgender are also victims of stigmatization of other key populations like MSM. The question is that in the field, it's difficult to mix some activity with transgender of men who have sex with men. Some activity give on the field are pre-exposure prophylaxis, condom and lubricant distribution, TB testing and treatment. Speaking about pre-exposure prophylaxis, guideline in Cameroon does not include transgender on pre-exposure prophylaxis. Sometimes when we propose for each transgender one to have a pre-exposure prophylaxis, she needs to identify herself as men who have sex with men. Or for those who are very sensitive or your gender identity, it becomes difficult to them to benefit, to have the prophylaxis and reduce the uptake. Also, after testing, when you put somebody in the treatment, most of the services are not focused on transgender. You have some access or mental health who are not enough and have an impact on the retention. When you see all the guidelines you have on the Cameroon, it's just this year that a word transgender was included on the H National Plan Strategy. Since that, is Naya are working on the HIV, but it's just now. Now you have transgender on the age national plan strategy. And the absence of that word in the field have a lot of impact on the implementation or the participation of more partners. When you want to work, some may tell you, no, I don't see that work on the guideline in Cameroon. I'm not confident to work with those populations. As we have some CBO or some NGO who are working with population, and we are able to convert some facility to give those services. It's true that stigmatization remains, but most of those NGO or CBO who work with transgender is under PEPFAR or Global Fund. This is some of activity, how activity is done on the field. We have CBO at the level, some facility on outreach services. You see that we have the same activity, but on the other hand, we have some CBO who don't have fund, who work only with outreach services and online, who have other people, and some partner who can facilitate the treatment. The idea where we want to reach is have something like this. All partners work together. CBO, NGO, and other partners who can come to introduce, to help us on fight between HIV. Way to forward, we need more data. Lack of data is another challenge. Most of the time, I'm saying that if you not have data, it's not possible to take a decision. Due to the fact that law guideline will not give us the possibility to design a study about transgender, it was difficult to do study. Now, I hope that with the new guideline, we will be able to do that and have a more finance to make the study. On the other hand, we need to train health providers. We have a challenge that we have few health facilities who agree to work with transgender, but some who agree to be trained are very few, or most of the time, maybe after 2-3 years, they have changed the city. If we are able to train more health providers, I think we have an advantage about transgender issue. Also, find a plan how to mitigate stigmatization. It's not easy, but compare what you see about female sex workers and men who have sex with men. Stigmatization among transgender is very high and difficult to work in the field. Also, about hormone use. Due to the fact that we are not have a legislation about hormone use, some of the beneficiaries go through the pharmacy and have what they can and use and say not in the right way. Sometimes it is called difficult to have a severe damage who are after they become irreversible. That is, on the other hand, we need to work on it and put in place a harm reduction to use of that hormone therapy. Thank you.